Welcome, and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. How would you like to learn to live pain-free? Many of us think that as we age and we start to feel those aches and pains, this is just a sign of something that's inevitable, that our body is breaking down, we're aging, and that there's not really a whole lot we can do about it. But actually, when you start thinking about how these aches and pains began to occur, you have to look at your lifestyle, particular habits that you have, and ways that you carried yourself or perhaps pushed yourself over the years, and pain just starts to evolve and actually surface as a result of years of perhaps poor posture, perhaps just not doing the right thing. On our program today, we're going to learn how we can begin to live pain-free. I mean, could you imagine that? And our guest today is a national presenter and highly popular neuromuscular therapist, as well as yoga instructor at the world-renowned Carpal Center for Yoga and Health in Lenox, Massachusetts. Our guest is dedicated to helping people to help themselves. He creates practices and teaches integrated positional therapy protocols to reduce and often eliminate chronic pain. He is the author of the book, Live Pain-Free Without Drugs or Surgery, as well as Yoga for Pain Relief. And he is trained in neuromuscular therapy, orthopedic massage, positional therapy, yoga therapy, and myofascial release, and has conducted seminars with thousands of people from all over the world. I'd like to welcome to the Beyond 50 radio program today our guest, Lee Albert. Lee, thank you for being on the program today.
Thanks, Daniel. Appreciate you having me. I'm looking forward to sharing my knowledge and helping as many people as I can to live pain-free.
Well, moving forward is exactly what I'm sure most of our Beyond 50 people would like to do if they just didn't have that pain that kind of prevented them from feeling like they could do it with bliss. How do we go about doing that?
Well, that's a great question. So, almost everybody has some aches and pains they're dealing with in their life. And we're often told, well, you're getting a little older, you should expect that sort of thing. Well, I'm here to tell you should not expect that sort of thing. These aches and pains that a lot of us have are not due to being older, but they're due to a very common cause, which is what we're calling a muscle imbalance. Now, a muscle imbalance is a pretty simple concept. I'll explain it very quickly. It means some muscles become too short in our bodies and other muscles become too long in our bodies due to the way we're using our bodies. And the easiest way to think about that is if you'll see most people are a little hunched forward in their shoulders a bit, which means the muscles in their chest become a little short, but then it pulls the muscles in their upper back a little too long. And those imbalances pull the bones out of alignment. And that's what causes 80% of all the pain a person has in their entire life.
It's pretty amazing to think about some of the things that you outline in your book and you realize, wow, these are these subtle things you don't really think about, but they have a huge impact on how we feel. Now, one of the ones I wanted to point out is you talk about, pretty much all of us have a pelvic bone. And that probably a majority of us, if not almost all of us, have it where it's just slightly out of alignment, and that creates most of the body pain that we're feeling. Now, tell us how you came to that conclusion there.
Yeah, so if the analogy I often give, so your pelvis should be thought of as the foundation of a house. So in other words, if the foundation of your house is crooked, your physical house, the whole house is crooked. Everything, including the chimney, will be crooked. So in the body, when your pelvis is crooked, everything above it and everything below it is a little bit crooked. So everything above it is skewed a little bit, and everything below it is not bearing weight the way it was designed to. And it's that mechanical change that causes our joints to wear out prematurely as well.
Now, it's funny because I wanted to bring this up because you realize this is one of those long-term subtle things that people don't think about until all of a sudden pain begins to surface. Now, this occurs, one of the things you talk about is, for instance, sitting posture. And what came to mind as I was reading this in your book, Live Pain-Free, is I remember going back as far as grade school. Some of the kids there that were sitting in class that would slouch way down in their chairs as though they were virtually laying their chair asleep. The teacher's always saying, hey, you need to sit up, and eventually that kid would just start slouching down again. Let's talk about slouching, because a lot of people do this even into their later years.
Yes, that's so true. So, I've been doing this work for over 30 years. I've worked on probably 35,000 people. And in my observations, I believe that at least 50 to 60% of everybody's pain is coming from the way they're sitting. So, the typical advice is, well, sit up straight. Well, that sounds great, and our goal is to make you straight, but the truth is it's almost impossible to do it for any length of time. Once your head goes in that computer screen, you can't remember to sit up straight. You can't really sit up all that straight driving a car neither. So, to tell a person to sit up straight is kind of the right idea, but it just doesn't work. So what I recommend is to get a good sitting posture is to use a little bit of a lumbar support in your back. Now, I don't often recommend one that you can actually go out and buy, because the truth is all you really need is a small little pillow, and we're going to place that in the small of your back. That's where your lumbar is, and that's where it should go. So if you did that anytime you were going to sit for long periods, like long car drives or a long time at your computer, by putting that little pillow in your back, it will tilt your body so you're up on your sits bones, and it'll bring your head and shoulders back into alignment. And it will keep you there very comfortably as long as you don't make it too thick. And, I have a free video of that on my website so people can watch that and kind of get the idea of how they can do that for themselves very quickly and easily.
Okay, now go ahead, if you could, for our listeners, share some of that you're talking about here, about what they could do now to make a correction.
Sure. So let's say you're in your car. So, in most cars are these kind of little bucket seats, and you can kind of sit up straight. You can make the seat back a little straighter, but, it still doesn't get you where you need to go. So I keep a little pillow in my car. I get that pillow, I roll it up, and I stick it in the small of my back. Now, if it's too thick, it's going to be uncomfortable. And if it's too thin, I know that my head and shoulders are still going to be forward of my body a little bit. So you play with it a little bit until you get the right thickness for you. It'll be different for everybody, and every seat needs a little. So it's just a matter of playing with it, experimenting. When it feels comfortable and you feel like your body is fairly aligned, then you know you have it. And, that will go a long way towards, improving your posture down the road. So when you see older people, bent over, that's not because they're older. Because they've been slumping in their chairs since grade 1 in their desks, right? And the more you slump, you train the muscles to go out of balance, which then pulls the bones out of balance. And then that leads to back pain and neck pain and all sorts of other conditions.
Wow. And the other thing you talk about, too, and this is something most people don't think about, is how you walk. What is your posture then? And how much time we find ourselves as we're standing in a particular area, we tend to lean.
That is so true because, we're a sitting culture. So every time we sit in our chair, the muscles on the front side of our body go into a shortened position. So then we stand up and those muscles remain a little bit short and we're leaning forward. So one of the great tricks I tell people, you can do this in line at the grocery store, just about anywhere, is when you're just standing somewhere, gently squeeze your shoulder blades together and hold it for at least a minute. And you'll see what that does is the shoulders come back, the head starts to come back over, and it starts to take that lean out of the body. And you're starting to train your body to be straight again. You'll notice that indigenous cultures that don't sit in chairs very much have much better posture because they're not training their muscles on the front side to go short day after day. But since we have to sit, that's one of the keys. Squeeze the shoulder blades together, which gently stretches the chest. Hold it. I do that at least probably 7, 8, 9, 10 times a day, and it really keeps my posture good.
Now, you outline many different types of pain that this comes on to relieve in a very natural, again, drug-free way. And let's talk about some of the common ones here that this particular system you've developed helps.
Sure. Well, the most common complaint in the country when the person goes to a doctor is low back pain. This is almost an epidemic. we are spending in this country alone $100 billion every single year just on low back pain. And what I've noticed is that, it's not, and this includes stuff like sciatica, by the way. This is not about your low back per se. Your back is what hurts, but it's actually coming from two main muscles in the front of the body. One is your quadricep muscles, and one is your psoas muscle. These are deep muscles in the front that go short every time you sit. When those muscles are short, they pull your pelvis forward of your body, and it's called an anterior pelvic tilt. And when that pelvis goes forward, it will put compression and pain in the low back. So when you go to a typical therapist, they'll rub your back, they'll work on your back, they'll put some healing ointment on your back, and that's all fine, but that's treating your symptom. And of course, you want to get your symptom treated until you can feel better. But the long-term solution for low back pain is to stretch those quads and psoas muscles every single day. And when you do that, your pelvis will go back to neutral, and low back pain starts to disappear. As a matter of fact, if everybody in the country would do those stretches every single day, I am pretty sure that we would cut that number of $100 billion at least in half.
Wow, that's amazing. Now, one of the things I looked at here is TMJ. Now, isn't that related to the jaw?
Yes.
Okay.
TMJ means temporal mandibular joint syndrome. So, and this is also becoming a little bit of an epidemic here. So when the muscles that are attached to the jaw become very tight, they will pull the jaw joint out of alignment, and that is extremely painful. Now, a lot of people don't have TMJ per se, but they have very tight jaws. And I believe this is due to the amount of stress in society these days. It's a very stressful world. Many people have very stressful lives. So when your body goes into stress, it starts making adrenaline, which makes all the muscles tighter. Now, if we were in a more primitive society and we went into stress, we would either run or fight, or because we're in fight or flight when we're in stress. We'd run or we'd fight. We'd burn that adrenaline off. So in our modern society, we have no way to burn that adrenaline off. So what happens is people end up grinding their teeth at night to try to get some of that off. So what I do recommend is, some nice, slow, gentle breathing to help people get rid of the adrenaline in their body and to start to eliminate a good amount of stress in their life. Slow, deep, gentle breathing will often do that for a person.
Now, I think I'm having that particular kind of problem, too. I noticed that this began to occur probably about a year ago, where I would be asleep in bed, and all of a sudden I would feel this jaw pain as I was laying on the pillow, and then I would kind of turn over. So, and now what I'm feeling is I maybe lay on one side, and if I open and then shut my mouth on my right side, just under my ear, there's a pain like my jaw is dislocated. So is that what you're talking about there?
That's exactly it. So
now, how does something like that happen? Because I don't tend to feel like I'm stressed, like I bite down. Of course, once in a while I'll pop my jaw, but, what's going on there?
Okay, well, there could be a couple of things here. So first of all, let's look at we'll forget about the stress thing for a minute. I'll come back to that. But if you think about it, I believe that TMJ it's almost all the conditions in the body start with that crooked pelvis. So when your pelvis is crooked, your spine is sitting on your pelvis. So now your spine is crooked. And when your spine is crooked, it means your head is crooked, which means your jaw is also crooked, you see. So most people have what we call a head-forward posture. And that's the beginning of TMJ-like symptoms. Okay? And now you add some stress to that. Even if you don't think you're particularly stressed in your life, there's so many things, somebody cuts you off in traffic, or you have deadlines, or there's just so many things. And the body, a lot of people don't even know they're grinding at night, but the body will want to grind at night to help burn off a little bit of that adrenaline and try to bring the body back into balance again. Because every system in the body is always programmed to bring it back into balance.
Wow, amazing. So we can do the exercises that you outline in the book, and that will actually get rid of that pain because you're doing what exactly?
Yeah, so you're actually going to bring the body back into alignment, which means you're going to bring the muscles back into balance.
Mm-hmm.
So if you remember, every muscle in the body is attached to a bone. So when they go out of balance, some muscles are going to go too short, and some muscles are going to go too long. And that pulls the bones crooked. And when those bones go crooked, that jaw joint doesn't want to work right because they're not lined up correctly.
All right, now let's talk about a couple of more that are very common, and I know when I put these out there, people are going to go, yeah, I've got that there. There's no doubt about that. One of them is carpal tunnel syndrome, and especially with a lot of people today, you see people with cell phones doing a lot of texting, a lot of people who actually work at computers. What are some other areas that people actually get this particular syndrome as far as work or even lifestyle? And what can be done about it?
Yeah, so carpal tunnel syndrome is anybody gets it who uses their hands a lot. So carpenters can get it, dentists can get it, surgeons get it, musicians get it, hairdressers, anybody who's using their hands a lot. So if you think about it, if you're sitting in a chair and you just put your hands on your lap, with the palm facing up, you'll notice that the fingers curve towards you a little bit. That means that the muscles in the forearm on the palm side are shorter than the ones on the back side of the hand in the forearm. So the carpal tunnel is on the palm side of the wrist in that little area there, and there's a nerve that runs through that. It's called the median nerve. It's the only nerve that runs through that tunnel. So when the muscles around that nerve get too tight, because we're a gripping society, that can put a little pressure on the nerve. And when you got pressure on that nerve, boy, it's painful, let me tell you that. So the simple solution, and this is preventative as well, is to gently stretch the muscles on the palm side of your forearm, just by pulling your fingers back and holding it a little bit.
Wow.
And if you can do that 2 or 3 times a day, typically you prevent carpal tunnel. If you have it, you can eventually start to mitigate that problem.
Oh, very good. And here's another one for us now. I know I've had this actually quite a bit lately, and I think a lot of it has to do, when I get done and I've had a long day and I'll lay down on the couch, which I don't typically like sleeping on couches. If I feel like I'm going to take a nap, I'll go and lay down in the bedroom. But that being said, how we tend to lay on the couch, then we'll turn and we'll actually rest on our shoulder, like in my case, my right shoulder, and then the pain actually extends from the lower part just below actually my skull, if you will, down to the shoulder joint. And oh boy, I'll tell you what. And I know that's what it's from, but then all of a sudden I started feeling a pain that stretches from, let's say, the top of my I want to say my shoulder plate in the back down to almost the middle of my back, but on the right side specifically. And I know that's got to be what it is.
And those muscles back there, those are very common areas. People get it all the time because, again, we're a head-forward society. The muscles in the front are too short. The muscles in the back are actually like overstretched rubber bands there. So, you lie in that position, you exaggerate that. So those overstretched muscles, you're pulling them just a little bit longer, and that shoots the pain. So, the best thing you can do for that is my little trick for standing in line at the grocery store or anywhere, even sitting, squeeze those shoulder blades together and hold them. And, gently squeeze them together. And you hold that and for a minute several times a day. And then, use a pillow in your back anytime you're sitting because most chairs will push your head forward too. So once you do that, you can retrain those muscles to come back into balance. Now, it doesn't happen overnight, but it can happen, 1 or 2 months. You can retrain those muscles to come back into balance.
That's always encouraging to know. Here's another one, hip pain. We were talking about, an out-of-aligned pelvis here. So how about that?
Yeah, so hip replacements are becoming so common these days, and you often hear, you're getting older, your joints are just wearing out because we're not designed to live this long. Yeah.
I'd like
to
find out the people that actually started all that, where they said, you're aging, it's inevitable. And I've seen a lot of hardy people out there that don't feel any of this. And, again, you have to take a look at, well, what were your habits? And if all habits can be changed. And if that happens, then pretty soon the inevitable outcome changes. Pretty interesting how that works.
Yeah, absolutely. So the truth is, if everybody's pelvis was lined up, their hip joints would bear weight the way it was designed to, and they would last to well over 100. That's what they're designed for. But, just like the tires on your car, if your front end of your car is out of alignment, your tires are going to wear out quicker. So if your pelvis is out of alignment, and most people do have it from a lifetime of sitting, what happens is your tires are now your hip and knee joints. So your hips and knees wear out prematurely, not because you're older, simply because they're not bearing weight correctly. And by doing, 3 or 4 simple stretches, you can bring your own pelvis into alignment and keep it that way.
As I'm listening to describe this, you realize not only the simplicity, but the reason behind, how all this surfaces. And we seem to be a society that is so driven to being pain-free through the use of drugs. Mm-hmm. I have to ask, how necessary is that?
Right. So, I'm not dead set against drugs. I had a kidney stone once. I wanted a drug very quickly.
I agree with you. It's funny how you'll hear people out there, too, all those evil pharmaceutical companies. And I'm like, look, just go out and do what you need to do, but then find ways to correct it, that you don't have to become dependent on it, for crying out loud.
Exactly. So, use your painkiller, in conjunction with your doctor to get that short-term relief. But it's only working on your symptom. And when the drug goes, the pain comes back. That's why you got to look for that long-term solution. And since the stretches I give are so easy and so simple to do, I just have to say a quick thing about that because I talk about stretching a lot, but we need to talk about how to stretch too because I always tell my clients humans really don't know how to stretch very well. Animals know how to stretch. If you watch your cat or your dog stretch, they always look happy. And yet you'll see humans go to a yoga class or somewhere and they're stretching and they almost look like they're dying. They're in so much pain because they're just stretching way too deeply. And when you stretch deeply like that, the brain tells you you're doing a good thing. But I can tell you when you stretch deeply, the body locks up. It's afraid you're going to rip it. And for all that effort, you're getting nowhere. So I'm recommending gentle stretches of no more than 50 to 70% effort.
Wow, amazing stuff. And that was something I was going to talk about, too, because we've all probably heard at one time or another, no pain, no gain when it comes to exercise, and I'm sure you have a lot to say about that as well.
Yes. So no pain, no gain actually applies to the weight training world. So if you're training your muscles to, grow bigger and bulk up, you actually have to rip them. They get ripped. And then they grow back bigger and stronger. So in other words, if you worked out with weights and you're trying to get bigger and you're not sore the next day or so, no pain, no gain. That does apply. But it does not apply to anything else. It does not apply to stretching or any other kind of activity. So if you're stretching and you're in pain, you are actually doing yourself a little bit of harm.
Very good. Now, I know that you have a channel on YouTube that people can go to and they can find out more about how they can go about the book and, questions, answers, things like that. Tell us about a website people can go to find out more about all this.
Yeah, so my website is leealbert.com. That's LeeAlbert. And on there you'll find a few videos and you'll find where I'm teaching my latest classes, and I have some nice articles on there. People can start reading those and get a handle on how they can start treating their own pain, and a whole bunch of great resources on there, including some meditation. People often overlook the meditation part for calming the nervous system, which then eliminates a lot of pain in the body. And we're not talking about, sitting in a cave here. We're talking about some nice guided meditations with some music, which often calm people down so much, and the body starts making good chemicals like endorphins and kephalons, and everybody starts feeling good again.
Mm-hmm. Oh, very good. It's been a pleasure to have you here on the program, Lee, and certainly for our listeners out there, you certainly given them the opportunity to realize that it's very encouraging if you move the more natural way, if you can certainly do that and it hasn't gone too far. that they're able to do this. But as you said, it's a process that isn't going to happen overnight. It's going to take time because, after all, it took you a while to get to the point that your body's now saying, hey, I'm kind of sore here. Let's do something a little bit different.
That's right. So I tell people it took you 40 years to get here. If it takes you 1, 2, 3 months to get out of it, it's a pretty good deal.
Very good. Again, the book is Live Pain Free. Our guest joining us here on the Beyond 50 radio program today is Lee Albert. And one more time, if you could, go ahead and give out that website information. Yes,
it's leealbert.com, LeeAlbert.com. And feel free to email me too. My email's on there. I'm happy to answer questions for people.
Very good. Thank you again for being on the program today.
Thanks, Daniel. Appreciate it.
You bet. We want to thank you, the listeners out there, for joining us. If you're pain-free and you don't have that carpal tunnel syndrome, simply type in beyond50radio.com. That is the number 50. We do encourage you to sign up for our weekly e-newsletter to keep up to date with what's going on in the world of Beyond 50, as well as our upcoming programs. I'm Daniel Davis. Thank you for joining us. This is the Beyond 50 radio program, and remember, live your day past halfway.